Hello, I'm Dr. Marla Shapiro. I'm a professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees for the North American Menopause Society. I'm joined by Dr. Michael McClung, who also sits on the Board of Trustees for the North American Menopause Society. He's a clinical endocrinologist with a special interest in osteoporosis. So, as a patient in their 40s who comes in and wants a bone mineral density, when should we actually be screening patients? Because patients seem to want to have this test often at a young age.
Well, there's very little value, honestly, in a bone density test in a healthy premenopausal woman, because other than the general advice of reviewing calcium and vitamin D intake, recommending being physically active, and avoiding the few lifestyle things that interfere with bone health, there really isn't anything that can or could be done at that point. So the general time to think about bone density is at the time of menopause. That's the time when decisions are made about hormone therapy, or if bone density levels are found to be low, then perhaps one of the drugs that we use to prevent bone loss and to treat osteoporosis with.
So is there a magic age? Often we hear 65 is when we should start doing bone mineral densities. But for women younger than 65, what would encourage them to have a bone mineral density?
Right. So the recommendations by societies, medical societies, identifies people who would be at low risk for would be at risk for low bone density. That includes women who are older. That's where age 65 comes from. But for younger postmenopausal women, if they have a strong family history of osteoporosis, if they themselves have had a fracture since menopause, a wrist fracture or a fracture like that, or if they are thin. Being thin is a risk factor for low bone density. So women in the lowest quarter of the distribution of weight, that turns out to be 127 pounds from several studies, are recommended to have bone density testing at the time of menopause so that we could take steps to protect them from the loss of bone density that happens in the early years after menopause.
So once that's been done as a baseline, then how often should women continue to be screened?
Well, it depends on what the answer is. So if women have a totally normal value and they've already gone through the bone loss associated with estrogen, then revisiting bone density perhaps in 5 years would be appropriate. If someone has low bone density and is close to the threshold where we would make a decision about treatment, then perhaps to follow up a test in a year or two would be appropriate. So there's no magic number. The fun part, of course, about taking care of patients with osteoporosis is that we treat every patient as an individual person and make individualized decisions.
And for patients, in terms of knowing what good bone hygiene is, how do they take care of their bones, and how much calcium and vitamin D?
Well, there's only a few things we can do for our skeleton. Adequate amounts of calcium mean a total daily intake somewhere in the range of 1,000 to 1,200 milligrams. That includes the calcium intake from a diet. Rarely do women need to take more than 500 or 600 milligrams of calcium as a supplement each day to achieve that goal. Vitamin D intake, for those of us who live in the north where the sun doesn't shine so much, intakes of 1,000 to 2,000 units a day almost always assure vitamin D adequacy. That being physically active, although there's no magic set of exercises, just being up and around is important, and then avoiding smoking and excessive alcohol intake. And being nice to your parents and to your kids are the other things. That's the advice that we can give, I think, to everyone to optimize their bone health.
Thank you so much.
Okay.